Hi, welcome to Logical Ayurveda. Today we are going to learn about plantar fasciitis. Plantar fascia is a thick, flat band of tissue that runs along the base of the foot. Its duty is to connect the heel bone to the toes. Plantar fasciitis, as the name suggests, is the condition where plantar fascia becomes inflamed or thickened and patient will feel pain under the ball of the heel. Now, so this is plantar fasciitis, and what is calcaneal spur? Calcaneal spur is the bony outgrowth or extension at the back of the heel. It will be or will not be, it may or may not be associated with plantar fasciitis or Achilles tendinopathy. Usually, either plantar fasciitis or calcaneal spur or Achilles tendinopathy, these three are the main reasons for having the heel pain. So, if we can properly differentiate and diagnose and treat and find about what is causing, what is the reason behind the patient having the heel pain, technically it will be treated very nicely. Now, how do you confirm calcaneal spur? You take X-ray calcaneum or X-ray heel to confirm the bony outgrowth that is present, and you confirm the calcaneal spur. Now, how do you correlate this plantar fasciitis or Achilles tendinopathy or calcaneal spur according to Ayurveda? It is some of the Ayurveda physicians correlate this to Kudakavata, etc., etc. But I am telling, whenever you read a book, be it a textbook of general medicine or whatever, your brain and your eyes should act as a filter of converting the whole text into seeing it in a more possible Ayurvedic version. Unless we do that, we cannot be very successful as Ayurveda physicians. For example, if you are seeing that calcaneal spur is predominant in patients with obesity, or you see hypothyroidism is prevalent in patients with obesity, or any form of disease is prevalent with obesity, you should understand it is predominantly Kaphaja and Medaja conditions. To understand that it happens to predominantly Kapha Medokara people who indulge in the Kaphakara Nidanas, it is not a rocket science. So your brain should automatically act as a filter to find the doshas in whatever fancy English term that the modern medicine uses. Until and unless we do that, I don't think we can effectively treat patients on basis of Ayurveda doshas. So, how will I correlate calcaneal spur or Achilles tendinopathy or plantar fasciitis, etc. with Ayurveda? I only correlate it to Raktavrita Vata. What are the conditions of Shruta that Raktavrita Vata should be met? There should be sparsha asahishnuta. There should be tenderness on the particular part of the body. If a patient has heel pain, he comes with plantar fasciitis or calcaneal spur, you touch the heel and they jump because of pain, then it is Raktavrita Vata. And Raktavrita Vata should have shofa. There will not be much of the inflammation that is visible outside, but basically plantar fasciitis or calcaneal spur is an inflammatory condition. Patient has shofa inside, and there will also be redness of the particular part. By all this, you diagnose the patient as Raktavrita Vata and give treatment for Raktavrita Vata. So tenderness is there, pain is there, redness is there, and you treat the patient for Raktavrita Vata. Nothing else. Unless you simplify all the terms in Ayurvedic view and simplify it to bare minimum of doshas and panchamahabhutas, we cannot treat the patient. And have you heard, the best solution is always the simple solution. Always simple it down. Whenever you find something confusing to treat, always simple it. Always try to simplify it. So only problem in treating this Raktavrita Vata or Vata Rakta, whatever you take it is, to identify the dosha inside it, to identify whether it is Kapha Anubandha Vata Rakta, Pitta Anubandha Vata Rakta, or Vata Anubandha Vata Rakta, Vata Pradhana Vata Rakta. So how to identify all this, that is where the trick lies. So when you are referring a modern text, they always, any kind of text that tells it, the plantar fasciitis or calcaneal spur is mainly because of increase of weight. How do you understand this increase of weight? That is predominantly a Kapha Medokara Vikara or Kapha Vata Vikara, where we are treating or making the patient lose weight is the main part of the treatment. Because 1 kg increase in the body, 1 kg increase of weight, total weight in the body is 4 kg, is extra 4 kg pressure on the knee and ankle. Therefore, if a patient increases 10 kg, then there is a 40 kg pressure on the knee. Definitely it will pain more. Definitely they will have degeneration more. Because the amount of weight it has to bear is now fourfold. Then the plantar fasciitis is also tend to be very common in any kind of reactive arthritis, be it rheumatoid arthritis or gouty arthritis, inflammatory arthritis, and these don't tend to be involved, and they tend to undergo degeneration faster, and therefore they have calcaneal spur and plantar fasciitis. And it is also very commonly associated with fibromyalgia. Coming to the main deal. How do you identify whether the patient is having kaphanubandha vata rakta or pittaja vata rakta or vata pradhana vata rakta? So it is definitely by differentiating the symptoms. See, let us come to kaphaja associated vata rakta. Obviously, very obvious thing, the patient is overweight, number one. And there is a typical thing for kapha. When kapha patient always tend to associate with the morning stiffness or morning increase in pain and morning be it rheumatoid arthritis or anything, kapha patients are always associated with stiffness of some kind in morning. So similarly, in calcaneal spur, in plantar fasciitis, when the patient wakes up in the morning, when they keep the leg on the ground, there is a particular amount of shooting pain and the stiffness that is present in the early morning that improves gradually along with the time. So definitely the pain increases immediately after the patient wakes up after a long sleep and they keep the leg downside, and the pain also increases when the patient is sitting for a long time. Let's say the patient is sitting on the sofa or the chair for a long time and they suddenly wake up, they suddenly have severe pain or shooting pain when they put their leg down. So that is how we understand kapha. Even in knee pain, to understand kapha, I will ask them, sir, tell me, do you feel increase in pain after walking, or do you feel increase in pain after sitting for a long amount of time and suddenly waking up you feel shooting kind of pain? Which pain is more? So I will understand that if the patient is walking more and getting pain, then definitely it is some kind of degeneration or vata pradhana. Or when the patient is sitting for a long time and then he wakes up and then he has pain, it's definitely kaphanubandha. That is how we understand, not only in calcaneal spur plantar fasciitis, but for every disease, even osteoarthritis. For understanding the kaphanubandha, that definitely helps. So because kapha is always associated with mandata, stabdata, guruguna, kapha is always associated with amajirna. The patient asks the patient to show the tongue, it is coated, definitely they have some kind of ama or the kapha or mandata or ajirna that is going on. The patient is overweight, definitely there is some form of kapha that is going on. The patient is having morning stiffness, definitely there is some form of kapha that is being associated, that has to be taken care, that has to be treated. So that is how we understand kaphaja vata rakta. Then you give kaphaja vata rakta treatment. While treating not only kaphaja vata rakta, while treating not only kapha related plantar fasciitis, while treating all the plantar fasciitis, I'll give you an excellent tip or an insider information or a hack, or call it whatever, or to make the process, to simplify the process. You have to choose a medicine that is Mutrala and Shohara in nature. In what kind of vyadi you choose, there is a Kaphahara Mutrala, there is Pittahara Mutrala Shohara, there is Vatara Mutrala Shohara, and you have to choose the Mutrala and Shohara exactly according to the condition, because it is an inflammatory condition, and Shohara Mutrala definitely helps very much in reducing the inflammation. So that kind of kashaya, that is a hack that I learnt over experience and wisdom, that is very useful in plantar fasciitis. So in Kaphahara, Mutrala, Shofara, Rasna Saptakam Kashayam definitely helps. Rasna Erandadi Kashayam definitely helps. Punarnava Gugulu helps. Kanchanara Gugulu, Kaphahara, Shofara, Mutrala, Kaishara Gugulu, Amrita Gugulu, everything can be given. And when the patient is associated with associated with Ajirna, you can go for Vai Guliga, Dhanvantram Guliga, Shadharana Guliga, along with the Rasna Saptaka Kashaya or whatever Gugulus you prescribe. So you choose the medicine that is Mutrala, Shofar and Kafara nature. And Rasna Saptakam is my favorite choice. I personally don't use Rasna Erandadi much, because Rasna Saptakam works like a charm to me. That does not mean it, it must work for you. It is a personal bias. And Rasna Saptakam works excellent, and I have seen and cured n number of plantar fasciitis and calcaneal spurs only purely by prescribing, not only, Vrasana Saptakam appears to be the major drug in the prescription while treating plantar fasciitis, and the patient happens to be the Kaphaja Vatrakta associated patients. So there is the Vrasana Saptakam works like a charm. So you can also choose any kind of guglu you want. Kanchanara guglu, Punarnava guglu. Punarnava guglu basically contains gomutra and it is kaphahara. Kanchanara guglu is pushna. Amrita guglu is fine. Kaishara guglu is also fine. So you choose Vayu Gulika, Dhanvantara Gulika, Shadharanam Gulika based on the ajna that they have, along with the kashayas or as an churna dravyas for kashaya to digest. And also another hack like Vrasana Saptakam, another hack. Murivana works wonders. Murivana works wonders in plantar fasciitis and calcaneal spur, etc. Because plantar fasciitis or calcaneal spur or Achilles tendinopathy, any kind of this is abhigataja vatarakta basically. Basically, it is a degeneration when patient walks too much or has weight too much, and therefore they can have vatarakta. And there is nothing, there is no medicine in the world that is best in treating the vatarakta tenderness than Murivana, because it is basically designed. Murivana is designed to treat abhigataja vatarakta, and it is useful in other vataraktas as well. As per dosha, I mix other oils to Murivana. For example, if there is a patient is having kapha more, then I make sure to mix Karpuradi plus Murivana because it is Ushna. Add a little Ushna to it. Is just like cooking. Add whatever spices you feel that is doing justification for the particular dish. So basically Murivana is good. And you can add according to the dosha. Karpuradi plus Murivana, Kottam Chukadi plus Murivana in case of kapha, and Murivana plus Pindatailam in case of pitta. Or in case of vata, then Murivana plus Mahanarayana Tailam or Murivana plus Mahamasha Tailam, whichever you feel comfortable. That should treat a particular condition. You can mix, but the basic Taila should be Murivana because it is excellent in treating the sparsha shaishnu, the tenderness, and it immediately reduces tenderness. And in kapha, I always choose Taila application. Before giving Taila application, I choose Karta Marmani Vati external application or KM Lepam. There is a medicine in Kerala Ayurveda. There is an ointment, Karta Marmani Lepa. It is basically Ruksha Lepa that is being applied, and Ruksha works better in kapha. After that Lepa, if you go for Taila application, that works wonder. Or you can also advise Podikeyu to the patient, and Valika Sveda, or whatever form of Sveda that is justified for treating kapha and bringing the inflammation down. So that is highly that will be highly useful to the patient. So these are the hacks. So basically I use Murivana for all. What kind of oil I mix with Murivana? In kapha I mix Kottam Chukadi or Karpuradi.